Tennis elbow, also known as lateral epicondylitis, is a common condition characterized by pain and tenderness on the outer part of the elbow. Despite its name, tennis elbow can affect anyone who engages in repetitive arm and wrist motions, not just tennis players. It is caused by overuse of the elbow and the muscles and tendons of the forearm. Causes tennis elbow occurs when the tendons that attach the forearm muscles to the outside of the elbow become inflamed or degenerated. The most common causes include repetitive motions, activities that involve repetitive gripping, twisting, or lifting, such as playing tennis, painting, or using hand tools. Poor technique, improper technique in sports or other activities can place excessive strain on the elbow. Age. Tennis elbow is more common in individuals aged 30 to 50, as tendons lose elasticity and strength with age. Occupational risks. Jobs that involve repetitive arm motions, e.g., carpentry, plumbing, and assembly line work increase the risk. Symptoms. The primary symptoms of tennis elbow include pain and tenderness. Pain on the outer part of the elbow that may radiate down the forearm or up towards the upper arm. The pain may be sharp or aching. Weakness, difficulty gripping objects, shaking hands, or lifting items, as the condition can weaken the forearm muscles. Stiffness, reduced range of motion in the elbow, which may be accompanied by discomfort during certain movements. Pain with activity, pain that worsens with activities that involve extending the wrist or gripping. Diagnosis of tennis elbow typically involves medical history. A healthcare provider will review your symptoms and activity history to understand the nature of the problem. Physical examination. The provider will perform a physical exam, assessing pain levels and range of motion, and checking for tenderness around the elbow. Imaging tests. While not always necessary, imaging tests such as X-rays or MRI scans may be ordered to rule out other conditions like arthritis or fractures and to assess the extent of any tendon damage. Treatment for tennis elbow focuses on reducing pain and inflammation and improving function. Common treatment options include rest. Avoiding activities that exacerbate symptoms is crucial for recovery. Ice therapy. Applying ice packs to the elbow for 15 to 20 minutes at a time can help reduce swelling and relieve pain. Physical therapy. A physical therapist can develop a rehabilitation program that includes stretching and strengthening exercises to improve flexibility and strength in the forearm muscles. Medications. Over-the-counter non-steroidal anti-inflammatory drugs and SAIDs such as ibuprofen or naproxen can help alleviate pain and inflammation. Bracing. Wearing a forearm strap or brace can help reduce strain on the elbow and provide support during activities. Corticosteroid injections. In some cases, corticosteroid injections may be administered to reduce inflammation and pain. Extracorporeal shockwave therapy. This treatment uses sound waves to promote healing in the affected area and is sometimes used for chronic cases. Surgery. If conservative treatments do not relieve symptoms after 6 to 12 months, surgery may be considered to remove degenerated tissue or repair the affected tendons. Preventing tennis elbow involves several strategies. Warm up and stretch. Prior to engaging in sports or activities that require repetitive arm use, warming up and stretching can help prepare the muscles and tendons. Use proper technique. Learning and practicing proper techniques in sports or repetitive activities can minimize strain on the elbow. Gradual increase in activity. Gradually increasing the intensity and duration of activities can help prevent overuse injuries. Strengthening exercises. Regularly strengthening the forearm and wrist muscles can improve overall stability and reduce the risk of injury. Take breaks. If your job or hobby involves repetitive motions, taking regular breaks to rest your arms can help prevent fatigue and injury. Conclusion. Tennis elbow is a common and often painful condition that can significantly impact daily activities and quality of life. Early diagnosis and appropriate treatment are key to successful recovery. If you experience persistent elbow pain or discomfort, It is essential to consult a healthcare provider for evaluation and guidance. With the right approach, most individuals can effectively manage symptoms and return to their usual activities.